The next series of exercises strengthens the neck area of the spine. Pull the chin forward and pull it back into the neck. We perform these movements very carefully and gently. Do not try to create any great stretching tension. That would be wrong. It must be a very gentle stretching muscle movement. This movement must never be tightening or tense. This means that I try to pull the muscles very gently. Mentally, I'm in the cervical spine. Next exercise, turn your head to left and right and pull the chin to the shoulder or horizontally in the direction of the shoulder. Here too, I try to be mentally in the cervical spine. Imagine how the cervical spine rotates and stretches apart. Same exercise from the front. Turn your head and pull your chin towards the shoulder. If you feel any pain, do this movement even more gently. Do not go near the pain barrier. Any movement related to the cervical spine should be performed very, very carefully and gently. Next exercise. We tilt the chin and pull our head down. It is as if we are flowing down along the breastbone. We tilt the head backwards with about half the effort. And at the same time we mentally pulling the crown upwards. When tilting back, do not press your head down. Let us look at this from the side. Gentle tilt and I begin to pull the chin down. The cervical and thoracic spine area is stretched. Slowly I lift the chin up again. These exercises must be done very carefully and gently. Those who feel pain in the cervical and thoracic spine must be extremely careful. Therefore, the tilting back of the head must be done very carefully and without tension. In the next exercise, we turn our head backwards and look backwards. This means that I turn my head and at the end of the turn I try to turn the head slightly further and look behind me. The view goes backwards. I try to see as much as possible behind me. What is behind my back? Attention is focused on the cervical spine, where we try slightly to stretch the neck muscles. The same movement of the head to left and right seen from the front. We turn our head very carefully, slowly and without hectic. If we reach the end point of the rotation, we keep the force of the rotation a little upright by continuing head rotation, but really very minimal. The upper part of the body is pulled in this movement a little by maintaining the rotation. That's normal. Without tensioning the muscles must not be tightened or tensed or pressed in any way. This is very important. Continue the exercise. Tilt your head down and turn your head left and right. The crown pulls a little upwards at an angle of about 45 degrees. For someone more, for someone less. In this position we turn our head very gently, very carefully. We turn the head and look into the sky from left and right. I would like to emphasize that again. Every time you perform such an exercise, you are not allowed to experience any pain. If this is the case, stop the exercise immediately. Here you can see that my head is tilted forward by about 40 to 45 degrees and turned to left and right. The view is directed towards the sky. These movements are performed very slowly and gently. The cervical area is stretched a little. At the same time, we make sure that the execution of these movements is comfortable for us. Next exercise. Tend your head sideways towards your shoulder and pull out at the crown. The head is not only tended to the side, but also pulled out at the same time. In this exercise, we work simultaneously with the cervical spine and also partially with the thoracic spine. When we tilt our head to the right, the muscles on the left side are stretched significantly. Let's look at this from the front. Tilt your head to the left side and pull out the crown. This can be seen well in this view. First the head is tilted and then the crown is pulled out. We do not push our head downwards. In such a case, this would lead to the tightening or tensioning of the muscles. Instead, we stretch or pull the muscles. And that is why we pull ourselves at the crown upwards and to the side. Next exercise. Pull your head into the neck and make a circular movement with the chin. It is like gliding along the edge of a plate from one shoulder to the other. Then pull in the head and then we stretch the chin back to the left shoulder, make a circular arc-shaped movement to the right shoulder and pull the head into the neck. And the same movement into the other direction. Extend the chin to the right shoulder, circular movement to the left shoulder and retract the head back into the neck. And we relax. Let us look at the same again from the side. Pull your head into the neck, turn to left, stretch your chin horizontally towards the shoulder, and in an arched movement turn your head to the right and at the same time pull the chin forward. Watch your shoulders. Very often the shoulders are raised with up. It is very important that you always take care to keep your shoulders relaxed. The shoulders should move with you, but they must be relaxed. In general, all exercises of the neck and thoracic spine include movement of the shoulders. Therefore, you should always remember to let your shoulders relax and lower, so that this does not lead to muscle cramps in the cervical spine. Next exercise. Tilt your head back a little, very gently. Then we turn our head to the side and look at the floor. Gently turn the head to the right and to the left. Here you can see that the head is only slightly tilted backwards, but I can still see the ground. For people with existing complaints in the cervical spine area, this exercise has certain risks. If you are not sure about this exercise, skip it. The same from the front. Tilt your head back a little and turn to left. Look towards the floor and then gently and carefully turn your head to right and look towards the floor again. In the end position, both left and right, I try to pull my head a little backwards and to the left or backwards and to the right. I would like to underline this once again. If you think that this exercise is difficult for you or can lead to injuries, skip this exercise. Always make it to your rule. If you have doubts about a movement, then it is better not to do it. Next exercise. Tilt your head down, pull out a little at the crown, then slide your chin down and lift your head up again. Now combine two exercises. Tilt the head, slide the chin down, then move your head to the left side towards the shoulder and straighten. Tilt the head, let the chin slide down. Now raise your head to the right and pull it out at the crown and straighten your head again. And now once again unite two movements. Tilt your head to the left shoulder, then lower it down and move it to the right shoulder. Pull the crown, raise the head again. The same in the other direction. Tilt to the right, pull the crown, then pull the chin, and we move our head in a half-round movement to the left shoulder. Raise our head. Again in the opposite direction, in the same way. Tilt the head down, pull the crown, move to the right towards the shoulder, put out the crown, and we straighten our head up again. Let's look at this exercise from the side. Tilt your head, pull the crown, lower your head downwards and glide or pull a little with the chin downwards. Then move your head to the right shoulder and pull out a little at the crown. And straighten up again. If this series of exercises for the cervical spine will be performed daily, then I can confidently say that after 4 to 5 months there will be a significant health improvement. If you had problems in the cervical spine,